Hi, I'm Gabriela Kalkmann, and I will present this study Bilateral Chronic Subdural Hematoma, considerations of 26 cases. And this study was performed by me and Dr. Carlos Humberto Pereira, Dr. Antônio Carlos Silveira Azevedo, and Dr. Marcelo Barreto Barbosa. This study was performed in Brazil, and I am a medical student. Well, chronic subdural hematoma is a common disease in neurosurgical practice, and especially in the elderly. It usually occurs after mild head trauma, and its occurrence is unilateral in the most cases. Between 3.5% to 25% of these cases were bilateral. Well, this study was performed with 26 cases of bilateral CSDH. Well, this study was retrospective and about chronic bilateral subdural hematoma. And this study was assisted in the period from July 2009 to July 2012 at the Neurosurgery Service of Hospital João Alves Filho at Aracaju, Sergipe, in Brazil. Well, we treated 26 cases of chronic bilateral subdural hematoma, and we analyzed sex, age, predisposing factors, clinical picture, imaging findings, treatment, and complications. Male were affected in the 19 cases and female 7. The ages varied between 63 years and 95 years of age, with an average of 72 years. Previous histories of mild or moderate TBI were 13 cases, arterial hypertension, chronic alcoholism, diabetes mellitus, use of antiplatelet drugs like aspirin, heparin, and cerebral atrophy was present in 22 cases. Clinical presentation of the pseudotumoral form was present in 62% of cases, followed by psychiatric disorders. How were submitted to surgery in 17 cases with 2 boreholes on each side, and in the others, 1 hole on each side. How patients were submitted to bed rest in the postoperative period follow-up for 72 hours. Anticonvulsivant medication was used in 14 patients, and 8 patients had complications like hematoma recurrence and pneumocephalus. Postoperative death occurred in 5 patients, 3 due to previous cardiocirculatory conditions and 2 due to pulmonary complications. Well, in this image, we can see a computed tomography of the skull without contrast, and we can see bilateral subdural hematoma with mixed head density with great volume on the right side and deviation from the midline. Well, in the conclusion, we can see bilateral CSDH is common in the elderly. It is usually associated with TBI, diabetes mellitus, and antiplatelet drugs like heparin and aspirin. The most frequent complaints are headache and consciousness disorders. The prognosis is worse in relation to unilateral CSDH. Well, this is the reference of this study. Thanks.